What is a binge? A binge is first and foremost a condition characteristic of people suffering from alcohol addiction. This is when a person, after drinking for a long period, is unable to stop drinking on their own. These people by default do not recognize themselves as ill and by default do not see any problems with alcohol. I'll give a few practical tips on how to persuade such a patient to agree to inpatient treatment in a hospital. First of all, stop covering up his binges, stop covering up his debts, and stop covering up his absences at work. He needs to understand that he must take responsibility for all his actions himself. Secondly, choose a moment when the patient is sober at home and have a one-on-one conversation with him. Clearly set boundaries for him and present him with the facts, so that he understands that if he crosses those lines, he can no longer count on your help. And during such a conversation, you should already have information about who in your city provides treatment and qualified assistance, such as helping to get someone out of a binge at home. And then perhaps this patient will agree to be admitted for inpatient treatment. But there comes a moment when a sober conversation doesn't work out and the binge continues right before your eyes at home. Naturally, such a patient needs medical assistance. At the same time, you need to take into account the patient's age, as well as any comorbidities they currently have. You should also consider the duration of their alcohol use, and most importantly, this assistance should be provided by a qualified specialist. Please do not try to manage alcohol withdrawal at home using improvised methods. You might get lucky the first time, you might get lucky the second time, but there may not be a third, because this condition can lead to very serious consequences. Stroke, heart attack, and even death. And this by definition does not fit into the concept of patient's awareness or the seriousness of their condition, in other words, a critical attitude toward this state. And he thinks that next time he'll get lucky again and manage to come out of a binge without the supervision of qualified specialists. This must not be allowed. You need to persuade the patient to get treatment, because otherwise you could lose your loved one. At home, what is provided is, well, let's say, primary medical care. This is detoxification. First and foremost, the patient's psychopathic agitation needs to be relieved. The patient's autonomic symptoms need to be addressed. The patient needs to be calmed and given medication-induced sleep. Again, everything I've mentioned requires qualifications, the expertise of a specialist who has done this many times before. And then it's possible that providing this assistance will be successful. And once again, let me repeat, do not try to manage this condition with improvised methods. If you see that the patient has pronounced serious comorbid conditions, try to persuade them to undergo inpatient treatment. The advantage of inpatient care is round-the-clock monitoring and the doctor's immediate response to any changes in the patient's condition.